Hello, welcome back to the channel. Now, if you did these 8 movements every single day, it would be biologically very difficult not to live longer. And I don't say that lightly because there are hundreds and hundreds of research studies now pointing to the same conclusion, that these kinds of movements done consistently are more powerful than the vast majority of medications that I could sit across from you and prescribe. Just think about that for a second. A doctor telling you that what you do with your body every day beats almost all of the hundreds of drugs that we have available, drugs that have had literally billions and billions of dollars spent on them, but that only treat symptoms rather than the underlying cause. And the best part about this is that you don't need an hour every day. You don't need a gym. You don't need to do all of this in one go. You can spread these out throughout your day. You can build up very gradually. And eventually it just becomes part of your routine. The same way that having a shower is part of your routine, the same way making your coffee in the morning is part of your routine. You just do it without thinking about it because you've prioritized it. And if you prioritize these things, then we know, the science knows, that they will help you live longer. So if you're someone that isn't particularly active, then this video is for you. Hello, I'm Dr. Alex, here to help you live longer by preventing the things that I see every single day. And all I ask in return is that if you learn something from today's video, then please give it a like and subscribe to the channel. It really does help so much, and it allows me to keep making these videos for you. So in the A&E, I see the end result of years of inactivity all the time. And I don't mean that in a dramatic way. I mean that in the most literal, straightforward sense. I see people in their 60s and 70s who can't get up from a chair without needing help. People who have fallen because their balance just isn't there anymore. People whose hearts and joints and blood sugar have all slowly deteriorated over decades, not because of one big thing, but because of the accumulation of thousands of days where they just didn't move enough. And what gets me every time is how preventable so much of this is. And what I want to do today in this video is give you 8 movements. That's it, just 8 movements that if you did these every day would literally help you stay healthier and live longer for reasons that I'll get into later. This is not a gym program. This isn't a fitness influencer telling you to do a 2-hour workout every day. This is, well, just me, a doctor telling you what the minimum effective dose of daily movement actually looks like and why each of these things together matters at a biological level. So let's start with the most obvious and yes, the most boring one, which is walking. And I know what you're thinking. Walking, really? Is that it? But just hear me out for a moment because the research behind this, well, you can't really argue with it. Walking every day, even just 10 to 20 minutes, has been shown to lower your blood pressure, improve your blood sugar control, reduce your risk of heart disease, and even slow cognitive decline. And the reason it works so well is partly to do with your cardiovascular system and partly to do with your muscles. So when you walk, your leg muscles contract rhythmically, and that actually helps to pump blood back to the heart. And because of that, it almost acts like a second heart. Now, your blood vessels also respond to that increased blood flow by becoming more flexible over time, and stiffer blood vessels are one of the key drivers of high blood pressure and cardiovascular risk as we age. From a blood sugar perspective, walking after your meals is particularly powerful, and I mention this all the time, pretty much in every video these days. Your muscles are like a sponge for glucose, and when you use them, they soak up sugar from the bloodstream without even needing insulin to do it. So if you're pre-diabetic or if you're type 2 diabetic or you're worried about your blood sugar in any way, then just a 10-minute walk after dinner, well, after every meal to be honest, is honestly one of the most powerful things that you can do. Walking is literally the foundation. It's the thing that everything else builds on. And the research backs that up in a really striking way. A large study published in JAMA Internal Medicine that followed over 16,000 older women found that those who walked around 4,500 steps a day, yes, not a lot, had a significantly lower mortality rate compared to those walking only 2,500 steps. And the benefits kept increasing up to around 7,500 steps before leveling off. So basically what this means is that you don't need 10,000 steps a day. Yes, more is better, but just 7,500 really gives you a huge benefit. For most people, what this comes down to is that you just need to walk more than you currently do. If you're just starting out or you find walking difficult, then just don't worry about distance or speed at the moment. Just walk to the end of the street and then back again, or just a short distance and then back, because I guess for us, that would be a kilometre and back. The point is, start slow, start short, and then build up gradually as you become more confident. Wear protective shoes, try to walk on a flat surface if you can, and if you need a stick or a walking frame, then use it. There's no shame in that. There's no version of this where that doesn't count. The goal is to just move consistently and then build up from there. Even 5 minutes is better than nothing, and your body will adapt if you give it the chance. Number 2 is squats, and I want you to think about this very differently to how a fitness person would frame it. I'm not talking about squats to get bigger legs. I'm talking about squats because the ability to squat, to lower yourself down and then stand back up, is one of the single best predictors of longevity that we have. The people I see in their 80s who are still independent and sharp and still mobile, they can do this movement. The ones who struggle to get up from the toilet without help often can't. Your leg muscles, particularly your quads and your glutes, are some of the largest muscles in the body. And muscle mass is directly linked to metabolic health, insulin sensitivity, and, well, basically survival outcomes across every serious illness. Even just 10 to 15 squats a day maintains the neurological pathways that keep this movement pattern intact. Your brain needs to practice telling your legs to do this, and if you stop, well, that connection just gets weaker and weaker. Start with just body weight. Go down as low as is comfortable, and then do it every day. There's a famous study published in the European Journal of Preventative Cardiology where researchers asked middle-aged adults to sit cross-legged on the floor and then to stand back up without using their hands or their knees. And they scored them out of 10. For every point they lost on that score, the risk of dying over the next 6 years increased by 21%. That is ridiculous to think about. That test is essentially measuring the same thing as a squat. Your ability to get up and down from the floor is so tightly linked to how long you live. So to do this safely, what you need to do is stand in front of a sturdy chair to begin with. Feet around shoulder width apart, toes pointing slightly outward. Lower yourself down really slowly as if you're about to sit, and then push back up before you actually sit down. If that's too hard to begin with, and for some of you it will be, and that is absolutely fine, then just sit all the way down on the chair and then stand back up. That counts. That is the movement that we're aiming for. If you need to, then you can hold onto a worktop or the back of the chair for balance. But over time, as you get better, you probably won't need to do this. The key is to keep your chest up and try not to let your knees cave inwards. Go only as low as feels comfortable. Even a small bend and return is something powerful. And if you can do 30 a day to begin with, and even spread that across the day if you need to, then that is an absolutely amazing starting point. Number 3 is push-ups or wall push-ups if a full press-up isn't accessible to you right now. And it is a fairly big movement, so pushing against a wall is absolutely fine. Upper body strength is something that declines dramatically with age, and most people don't even notice it happening until it's already significantly gone. Push-ups work your chest, your shoulders, your triceps at the back of your upper arm, and crucially, your core, all at once. From a cardiovascular standpoint, there was actually a study in JAMA that followed middle-aged men over 10 years and found that those who could do more than 40 push-ups had a significantly lower risk of cardiovascular events compared to those who could do fewer than 10. Now, that is an association, not a perfect cause and effect, but it tells you something really important about what upper body strength represents for overall health. And it's not just cardiovascular risk. A major analysis published in the British Journal of Sports Medicine looked at data from nearly 2 million people and found that higher levels of muscle strength were associated with a 30 to 40% lower risk of dying from any cause. And that includes things like cancer. Upper body strength isn't about vanity. It is a survival marker. and wall push-ups are a completely valid starting point. For a wall push-up, stand about an arm's length from the wall. Place your hands flat at shoulder height and around shoulder width apart, and then slowly bend your elbows to bring your chest forward towards the wall, and then push back. And that's it. That is the movement. If that feels easy after a few weeks, then move to doing them on a kitchen worktop instead, which is obviously a bit lower. And if you want to try a floor push-up, then start on your knees rather than your toes. And that is a perfectly good progression there. The main thing is to try and keep your upper body in a straight line and not let your lower back sag down. Even 5 wall push-ups a day is a really good starting point here. And then if you can, build up to as many as feels achievable. Number 4 is single leg balance. Stand on one leg, 30 seconds on each side, and that's it. It sounds almost laughably simple, but the evidence behind it is really interesting. Falls are one of the leading causes of serious injury and death in older adults. We see it literally multiple times a day in the A&E. And your ability to balance on one leg is a direct measure of your fall risk. There was a study in the British Journal of Sports Medicine, again, that found people who couldn't balance on one leg for 10 seconds had a significantly higher risk of dying within the next decade, even after controlling for other factors. The reason this works is because balance requires a huge amount of nervous system coordination. It needs your brain, your inner ear, the proprioceptors on your ankle and knee, all constantly communicating. And like everything else in the body, if you don't use it, then you lose it. And the consequences of losing that are severe as you get older. According to the World Health Organization, falls are the second leading cause of accidental death worldwide. And hip fractures in particular carry a mortality rate of around 20 to 30% within the first year in older adults. What that means is that up to 1 in 3 people who break their hip as an older adult will not be alive 12 months later. A lot of that comes down to balance, and balance is absolutely trainable. 30 seconds each side and repeat it as many times as you like throughout the day is a great starting point, and it's hugely important as you get older. And the good thing is that you can do it when you're brushing your teeth, when you're preparing food, or when you're just on the phone. If 30 seconds feels impossible at first, then that is completely normal and actually just shows how important this is for you to work on. Start by standing next to a worktop or a wall and just lightly resting your fingertips on it for support. Lift one foot slightly off the ground, even just a centimetre, and then hold it there. Over days and weeks, gradually reduce how much you're touching the surface until you're barely touching it at all, then not at all, and then build up to 10 seconds, and then to 20, and then 30. The key thing is to go slowly and be patient with it, and always do this somewhere safe where you can grab something if you wobble. Number 5 is the hip hinge, which sounds really technical, but is basically a movement of a deadlift. And before you switch off, this can be done with absolutely no weight whatsoever. Stand with your feet shoulder width apart, a soft bend in your knee, and then hinge forward at the hips like you're pushing your bottom back towards the wall behind you, and then drive back up. And that is it. The reason this matters so much is all about what we call your posterior chain, which is your glutes, your hamstrings, and the muscles along your lower back. And this is an area that becomes chronically weak and tight in people who sit a lot. When that posterior chain weakens, your lower back has to compensate. And that is exactly how people end up with chronic lower back pain that then limits everything else they do. Lower back pain is one of the most common reasons people become sedentary. And being sedentary is one of the most dangerous things you can be for your long-term health. And I've done numerous videos on this in the past. The numbers around this are really staggering. A landmark review published in The Lancet found that physical inactivity is responsible for around 5.3 million deaths per year globally, which puts it on a similar scale to smoking. And one of the key drivers of inactivity is musculoskeletal pain, particularly in the lower back, which this movement directly addresses. 10 hip hinges per day just with your body weight are enough to build the muscles of your lower back and protect that posterior chain. The way to do this properly is to stand with your feet shoulder width apart and then have a chair or a worktop nearby if you need it. Keep a soft bend in your knees, don't lock them out or keep them perfectly straight, and think about pushing your hips backwards rather than bending forwards. There's a difference there and it really matters. Your back should stay relatively flat and not rounded. Try and keep good posture there. You only need to hinge until you feel a mild stretch in the back of your thighs. And that might only be a small movement to begin with, and that is, again, absolutely fine. If you have back pain already before doing this, then obviously go very gently and only move through a very small range of motion that doesn't cause any additional pain. This movement, if done carefully and consistently, is actually one of the best things that you can do for a bad back over time. But listen to your body. If it's causing significant pain, then clearly stop and get it checked out either by your GP or your physio. Number 6 is an overhead reach or some form of shoulder mobility work. And this one is about posture and the slow creep of stiffness that most people don't notice until they're in their 50s and suddenly realize they can't lift their arms properly anymore. And this is surprisingly common. When you sit hunched over a screen for years, your chest muscles literally shorten, your upper back rounds forward, and your shoulder joint gradually loses range of motion. Now, it might sound like a bit of a cosmetic issue, but it's not. It directly affects your breathing mechanics, your spinal alignment, and your susceptibility to shoulder injury. Simply reaching both arms overhead as high as you can, holding for a few seconds, doing some gentle rotations, keep those pathways open. Your nervous system also plays a role here because the thoracic spine, the upper back section, has direct connections to the sympathetic nervous system. And chronically poor thoracic posture is associated with chronically elevated stress responses. Getting that upper back moving helps to regulate that system. Research published in the journal called Spine found that thoracic kyphosis, which is the medical term for that hunched upper back posture, was independently associated with increased mortality in older people, as well as reduced lung capacity and increased risk of vertebral fractures, fractures in your spine. Your posture is not just about how you look, it is a genuine health marker. Now, you can do this either sitting or standing, whichever is more comfortable for you. Simply raise both arms out to the side and then up overhead, as high as they'll go without any pain. Hold for 2 seconds or 3 seconds and then just bring them back down slowly. If one or both of your shoulders are stiff or painful, then just go to the edge of what's comfortable and then hold there. Don't push into that pain. You can also do very gentle arm circles forwards and then backwards, which helps to lubricate the shoulder joints and keep the surrounding tissue mobile. Even doing this a few times a day while sitting in a chair, this absolutely counts and it will help you. The goal is to just take that shoulder joint through its range of motion regularly so the range of motion doesn't shrink over time. Number 7 is what we call a core hold, either a plank or something called a dead bug, which is actually a lying down exercise that is brilliant again for back pain. Your core isn't just your abs. That's the important thing to understand here. Your core is the entire system of muscles that stabilizes your spine, your front, your back, your sides, and when that system is weak, everything else suffers. Every time you walk, every time you squat, every time you pick something up, your core is supposed to be providing a stable platform for your limbs to work from. When it can't do that, other structures around it start compensating, and that is how injuries happen. A study published in the Journal of Orthopedic and Sports Physical Therapy found that people with chronic lower back pain had measurably reduced activation of their deep core stabilizing muscles compared to people without back pain, and that targeted core training significantly reduced pain and disability over time. Now, this isn't just about performance, it's about protecting the structure that holds everything else together. Just a 20 or 30 second plank every day, or even building up to that over a few weeks, maintains that spinal stability in a way that protects you across every other activity that you do. Now, if a full plank on your toes and hands feels too much, then start with what we call a box plank, which is on your knees and your forearms instead. Get onto the floor, rest on your forearms with your elbows under your shoulders, and then come up onto your knees and hold your body in a straight line from your knees to your shoulders. Even 10 seconds is a great start. If getting down onto the floor is difficult, then you can do a standing version by placing your forearms on a worktop and leaning into it at an angle, holding that position with your body straight. For the dead bug, you lie on your back with your arms pointed at the ceiling and your knees bent in the air, and then slowly lower one arm and the opposite leg towards the floor and then bring them back. It sounds quite complicated, but it's actually very gentle and very effective. And if you can do just a few reps of 10 seconds each day, then this will be enormously beneficial if you're starting from nothing. And finally, number 8 is what I call a brisk burst. And this is maybe the most underrated one on the list. It is a short, intense cardio spike. So that could be either walking up the stairs really quickly, doing 30 seconds of skipping, doing a fast walk or a short jog to the end of the street and back, anything that pushes your heart rate up briefly. Now, if you're elderly or you've got lots of health problems, then obviously be very careful with this one. Maybe speak to your doctor first, who knows your medical record, and see if this one is appropriate for you. Anyway, the reason why this one is so important is because of your VO2 max, which is basically a measure of how efficiently your body can use oxygen during exercise. And it's one of the strongest predictors of longevity that we have in cardiovascular medicine. VO2 max declines with age naturally. This is normal, but it is trainable. And you don't need to run a marathon to train it. Just short bursts of higher intensity activity, even 30 or 60 seconds, are enough to give your cardiovascular system that stimulus. Your heart gets stronger, your blood vessels adapt, your mitochondria, the little energy factories inside your cells, they all become more efficient. And that efficiency is what keeps your heart healthy, your blood pressure lower, and your body resilient as you age. A study published in Nature Medicine followed over 70,000 people and found that just 3 to 4 short bursts of vigorous incidental activity per day, each lasting around 1 to 2 minutes, were associated with up to a 40 to 50% reduction in cardiovascular mortality and cancer mortality in people who otherwise describe themselves as non-exercisers. 3 to 4 minutes of effort spread across a whole day. That is an extraordinary return on your investment. Now, for someone who's older or just getting started, then the brisk burst doesn't need to look intense from the outside. It just needs to feel a little harder than your normal pace. So if your normal walk is gentle, then your brisk burst is simply walking faster for 30 seconds, and that is enough. If you have stairs at home, then going up them at a slightly brisker pace once or twice counts as well. The goal is to just try and push your breathing a little bit to feel like you're working slightly harder than comfortable, and then let it settle. And again, if you have significant health problems or if you're elderly, then it's really worth checking with your doctor before doing anything that raises your heart rate significantly. But for most people, a 30-second increase in your walking pace is completely safe and genuinely effective. And if you can do this a few times a day where you get out of breath for a bit, then honestly, after a few weeks of doing it, you will feel so much healthier. Now, here's the thing that I really want you to take away from this video. If you read that list of movements and thought, well, I just don't have time for any of that, then I want to reframe it for you. None of these need to be done in one block. You do your single leg balance while you brush your teeth. You do your squats before you make your morning coffee. You do your plank while your lunch is in the microwave. You do your hip hinges during an ad break on a video or whatever. You do your brisk burst by taking the stairs instead of the lift. Spread throughout the day, these 8 things take maybe 15 or 20 minutes, and that's it. And together, they cover your cardiovascular health, your blood sugar, your joint health, your bone density, your nervous system coordination, your posture, your spinal stability, and your long-term independence. There is almost no system in the body that isn't touched by at least one of these movements. And if you had to pick just 3 from the list to begin with, then I would say the brisk walking, the squats, and the single leg balance. Those 3 alone would meaningfully reduce your risk of the things that I see taking people's independence away in the A&E. Most people are waiting until something goes wrong with their health before they do anything. And I get that because that's just human nature. But your body is constantly adapting based on the signals you give it every day. So if you give your body these movements consistently every day, then it will adapt in the right direction. If you neglect them, if you become sedentary, then your body will adapt the opposite way. The research is clear here. The biology is clear. You do not need complicated, you just need consistent. And if all of this feels a bit overwhelming, or you're somebody who feels nervous about this sort of thing, then don't overthink it. Don't put any pressure on yourself. Just pick one thing, do it today, start where you are, and just build very gradually. Small, consistent actions are what change your health long term.